Hey guys, welcome back again to my channel. It's Dale here, and I am a registered nurse currently practicing nursing here in Australia. I've got an amazing guest with me. I'll let her introduce herself and we can go from there.
Hi everyone, my name is Eukaria. I'm also a registered nurse practicing here in Australia, and I live in Sydney, and it's so good to be on Dale's channel.
Thank you. Guys, if you know how long I've been asking her to come on my channel, so today I'm grateful. Thank you so much.
You're welcome.
So I and Eukaria, we have a very special bond. We both left the UK almost same time and came to Australia.
I think 2 months before me, right?
Yeah, I came 2 months or 1 month.
I think
about, but yeah, I came before her, so we have that special bond. And we're going to be talking about her pregnancy journey. She gave birth to a child, one in the UK and one here in Australia.
Yeah.
So she has experience in both worlds, and I have got so many people asking me, how is it like maternity in Australia? How is it compared to UK? I said, me, I never even born. I never gone for UK. I never gone for Australia. How? So I knew that you were just the perfect person for me for this question. So yeah, can you tell us about like general your experience compared to the UK, like your pregnancy journey? How did you feel?
Okay, I think it's a bit of a long story. Okay, so I think in the UK, when I got pregnant, obviously you have a lot of benefits entitled to you as a registered nurse, depending on how long you've worked. So you've worked for obviously 12 months prior to your 15 weeks of pregnancy or so. There's a way the maternity policy goes. I think it's 12 months prior to your 15 weeks or thereabouts. Then you get the full occupational pay, as my HR called it then, the full maternity leave pay. But if you've only worked for like maybe 6 months prior to your 15 weeks of pregnancy, you really calculated it then you get half of the maternity pay, so you don't really get like the full pay. So this was what they told me, because I know then it was I think I had 5 days to qualify for the full maternity pay before I I was just disqualified by 5 days. So I didn't get the full pay. I only got half of the maternity. Also, when it came to the support, you get off for your antenatal visits, but as per new nurse then in the UK, I wasn't told that I was entitled to some time off, paid time off for my antenatals and all of that. And then when I attended my antenatals in the UK, I realized that they were not really so thorough, maybe because of the hospital where I gave birth, because with my sister-in-law's experience, they were actually very thorough with her. But in the UK, I wasn't given the vaccine, the DTPA vaccine, which is compulsory anyway. They give it to every pregnant woman. I wasn't given the DTPA vaccine, and then some of the tests that they were supposed to run, they actually forgot about it. They missed it. But the delivery journey was okay, but I didn't have like timely interventions, and I almost lost the baby. That's my daughter also. She came out so weak and nose and all of that. So I didn't get like that timely intervention. They kept waiting. But let's bring it back to Australia. Here, like, they are very thorough. When they don't miss a thing. Here, you can't just say, oh, I've done it in the UK, and they'll you have to redo it again. And when I came here, some diagnoses that they had missed in the UK. I came in when I was 6 months pregnant, and by the time I would attend the antenatals, I was already 7 months pregnant. But then they were so thorough. I had echo, I had a lot of things, from your history. They would do like thorough investigations and all of that. And eventually, I had a very smooth delivery. It's the best experience I've had so far. Like, you need to see the delivery suite. I wish you had. I wish you had come around to see the delivery suite. And I actually had the baby in my hospital, and oh my goodness, it was a wonderful experience. I had a midwife allocated to me, which is the same as the UK.
Yeah.
But the delivery suite was very good. When you're in pain, but
beautiful environment.
So beautiful that they provide you with this diversional therapy that you actually forget the pain. There was a betting pool in my delivery suite in my own room. There's betting pool if I decide to have warm water bath and all of that. There was this betting ball, where you can go to exactly play and all of that. And then the couch was there, the delivery couch was there. There was also
did you take pictures?
Yes, I did. I'll send pictures I took. There was also a long couch where my husband could, rest if he wanted to. Then there was this very little kitchenette there. It also had wardrobes, yes, and all of that. And then the little cots for the baby and resuscitation station for the baby. So it was well furnished. When I mean furnished, compared to my delivery suite in the UK, it was just the delivery couch and resuscitative equipment, the toilet, of course. And I don't remember seeing any of those other other stuff that I mentioned. And also, they were just fully staffed in the delivery suite. So after I gave birth, they gave me a bag. I wish I brought that bag. I'll still show you guys at some point during this video. In that bag, they give it to every woman who gives birth in New South Wales. I can't say everywhere in Australia, but in New South Wales, I know they give it to every woman who gives birth. And in that bag contains first aid kits, baby changing mat, baby towels. I think I had hand sanitizers. It's a very good bag. I go everywhere with it whenever I'm going out with my baby. It had a lot of things. And they also gave me like a certificate there before we left the hospital. They'll give you that certificate. It contains a special number, and with that number you can apply for your baby's birth certificate, which is done online. And also with it you can also apply to Medicare, because you need that certificate to apply to register the child for Medicare and claim Centrelink benefits. And I also uploaded that certificate when I was applying for my baby's citizenship. Let's not forget to mention that I know. Let's not also forget to mention that I didn't pay a dime. Zero. I've met a lot of pregnant people in the UK who are scared and migrating when they are pregnant because they heard that the healthcare in Australia is very expensive. Let me clarify that misconception, that as a permanent resident, I didn't pay a dime.
Tell them.
Because just like you have the NHS in the UK, we have the Medicare here to cover your medical expenses. The only difference is that you have to buy your medications when you're not in the hospital. So it's not like the UK where they prescribe medications, and because
in the UK
it's free.
It's not free. I don't know for when during pregnancy.
Oh really?
But medications in England is not free.
Oh really? I never paid a dime for medications.
Maybe it's because you're pregnant.
Because I was pregnant.
Because I know there are some benefits attached to pregnancy. You have free dental care.
Oh really? Okay, so
in England it's I think Wales and Scotland is free, but no.
Anyway, I didn't pay a dime, except you have to buy your medications. You only get to pay money if you are a non-resident. So I hope I've corrected that impression. But guys, overall, my delivery experience in here was superb. And when I mean superb, do you know, even when my baby was sick and we went to the emergency, this was like 3 days after giving birth, the speed they use attend to my pikin, make I speak out for pidgin so you guys will understand. And they did thorough investigation and even found what they were not supposed to discover. Yes, so they're very thorough, and that's one thing I appreciate them for. So overall it's the best delivery experience I had earlier, and my midwives are so amazing. Thank you to the midwifery team that were present that day.
And also it's good for people to know that you lived in London while you were in the UK, because that's very important. Because most people think maybe you lived in a very excluded area. No. Care. For you to be in London, and you didn't get that care you are supposed to get, because London is like the capital. You should have good care. And you didn't get it,
and it was a long wait for appointments. If I needed any special appointments, I had to wait a longer period for it, which is different compared to here. So once you're pregnant here, the appointments come in very swift. You don't have to wait for a very long period of time. Highest 1 or 2 weeks you get your appointment, because I know there were some scans that I had and needed to wait for a long period. And they're just she needs to have a scan today, and they just took me to the department and I had the scan and all of that. So for my specialty referrals, when I had to see the specialist, I didn't have to be on that long queue compared to where we are coming from in London, where you have to wait for a long period of time to get the appointment. No, I didn't have to wait for that long period of time to get the appointment. And the ambulance, oh my goodness, as soon as you call them, they arrive. They're in every corner.
You paid for ambulance, right?
I paid. So yes, so that's it. So my baby had a medical emergency, and I phoned the ambulance. I thought it was exactly. So the speed with which they came, they just came. I was like, wow, that was quick. So after 2 weeks, I opened the post box and letter, ambulance. It was around $452 from here to.
How many minutes drive?
From here to the next station.
That's like 5 minutes.
5 minutes drive.
And you paid 400.
Just
did
say
they use,
5 to
did
8
they
minutes
use
drive.
any equipment on your baby?
No,
Like,
no.
oxygen,
No, we
nothing?
just sat on the stretcher.
I'm waiting for you
Straight to
Bago. Anyway,
Straight to
life is
life
important.
first. But anyway, these are the little things that you have to know and all of that. So
do you not have like insurance for ambulance cover? Did you
So-
get refund back?
No, I didn't get any insurance because as a new resident in Australia, we are allowed to like actually stay for 1 year without a private health insurance before you begin to pay the levy. So we are still within that 1 year grace period. So we get the insurance next month. We don't have to waste that money yet. It's not a waste, but then let's enjoy the Medicare until then.
Because I think if you had ambulance cover, they would have,
We won't pay
you
that
won't
much.
pay that much.
Yeah.
Yeah.
So there are things like ambulance cover that you can get to actually cover your.
Okay. But overall, I'm glad you
I had a
enjoyed
better
it.
experience.
Are you looking
I
forward
had
to another one?
No, not yet. But I'll share you pictures and videos that I took of the delivery suite, and you can actually see the difference between each.
And
setting.
this is like government hospital. You can imagine how the private will be.
Oh my goodness!
If-
Because
if
a lot of
government-
people were encouraging me to go to the private, but
Yeah.
because we didn't have private insurance, then I was like, let me just enjoy the Medicare benefits and
And
go to the.
still the
But
the
and also there are
experience.
more specialists in the government hospital
Yeah,
compared to the
definitely.
private. Yeah, so these were what influenced my decision.
And you never felt for one day that you were in a government hospital where
No, it's very nice. Like it's very when I mean beautiful. I wish I'll get pregnant again and go back there. It's a very beautiful place to be, And when I mean fully staffed, they are fully staffed, and they are all well experienced staff.
So during your whole pregnancy journey, giving birth here in Australia, did you ever feel like you were treated differently because of your skin color?
No, as well. In terms of my work or in terms of my care.
Yeah, your care as a patient.
No, not at all.
Okay.
I was given the due care that I deserved, if not more. At any time, there was no racial discrimination or anything, so I got the same care as much as everyone else.
So I don't know if you know about in England, there's a particular thing going around where women of color that are dying during pregnancy, childbirth because of neglect and racism.
Probably why
It's quite high in England, to be honest. Like it's
Oh, really?
Yeah, it's
probably
really
why my doctors in England were so scared, because it got to a point I had very prolonged labor and I was so hungry. I was induced in both pregnancies. I was induced. So, but in England, it got to a point I was so hungry. I just needed to eat badly. Like I was exhausted, and my baby was like I told you, my baby came out very weak. So it got to a point, and I was like, you know what, guys? I think at this point we just need to have a CS. And it was so obvious. The doctors, they knew that we needed to have CS. That's why I told you I had like delayed intervention and all of that. They knew that at this point CS was the answer. But then they prepared the theaters and everything. Then they kept delaying. They didn't want to do the CS. Then I'm not sure if it's the anesthetist or somebody came in and said, can you just give me 1 hour? And if this baby doesn't come in 1 hour, we'll go ahead and do the CS. I looked at my husband and he looked at my husband was so scared and he was like,
and that was your first baby?
She said, second. She said, you know what, I'll give you guys time to think about it. But she really begged me for that 1 hour. And she said, this is a major surgery you're going for. But I strongly believe the baby will come in 1 hour.
Were you dilated?
I wasn't dilating.
Nothing at all.
This was after around 5. I was in G's at 5 a.m. in the morning. And G's, I'm telling you, it was around 11 o'clock. And I was just 2 cm.
Just 2 cm, and she said 1 hour.
You understand? And she said, please give me an extra hour. I looked at her, I said, my husband begged me, he said, baby, just give her the 1 hour. I gave her, and baby came within that 1 hour. So I guess maybe this was the statistics, maybe this was one of the reasons why she was scared to go ahead with the surgery. But that's
thank God,
understandable.
thank God. So